In this presentation, we're going to review the Rush Airtraq system and the A390 Wi-Fi camera and intubation blades. We'll discuss the Maryland Medical Protocol as it relates to video laryngoscopy. We'll compare the Airtraq to the King Vision. We'll review the product, its operations, and how to clean it. The Maryland Medical Protocol specifically addresses video laryngoscopy and the recording device. According to Maryland Medical Protocol, the device must meet requirements in order to be considered acceptable for use. These requirements are listed on the left. Indications for use of a video laryngoscope are very similar to those for direct laryngoscopy. When using a video laryngoscope, providers must have completed didactic and practical training, including a thorough review of the device and demonstration of competency. When the device is used in the field, providers must ensure that they complete a video laryngoscopy device form. The program medical directors will then review this form and provide a report to the state quarterly. A copy of this form can be found on the Fire Manager website as a fillable form in the Forms tab or a downloadable form in the storage library. It's also available on the library website in the members area in the document library under the Forms section. When used in eMeds, the procedure to be documented should say airway video laryngoscopy. It's important that this procedure be documented every time the Airtraq is used. The Airtraq and the King Vision share numerous similarities, but yet have numerous differences. We're comparing to the King Vision because that is the device that is most frequently used by providers in this region. Similarities between the two devices include the detachable video screen from the blade, the one-time use design of the blades, and the fact that both are relatively capable of recording intubations. However, there are also several differences between the two devices. The Airtraq requires no adapters for pediatric applications, just that the provider select a smaller size blade. The recording capability on the Airtraq is internal and starts automatically when the device is connected. In the event of a video screen failure during intubation, the video screen can be removed from the blade, the eyepiece can be reattached, and the blade can be used to complete the intubation. Also, the Airtraq is small enough to be used while a Lucas is in operation. We'll quickly review the device and the intubation blades. The intubation blades come in multiple sizes from pediatric to adult. There's also a dual lumen blade and a nasotracheal blade, but those two will not be in service on Lineborough apparatus. We will carry the 4 blades you see listed on the bottom right corner of your screen. The blades are channeled to make tube insertion more efficient and do not require the use of a stylet. Each blade is self-lit and self-heated and has an anti-fog lens. The A390 Wi-Fi camera records automatically as soon as a blade is attached and has a 240-minute runtime on a full battery charge. We're going to briefly review the operation of the Airtraq A390 video and the laryngoscope blades. The following videos are provided by Teleflex as a training option. The videos are short, so please be sure to view them in their entirety.
The Rush Airtraq SP blades are single-use and designed to facilitate intubation. It allows full visualization of the airway, which can be performed directly through the eye cup, packaged with each blade, or by connecting it to the Airtraq Wi-Fi camera. Use of this device does not require hyperextension of the neck and permits patient intubation in virtually any position. Start by selecting the appropriate size Airtraq SP blade based on the size of the endotracheal tube to be used on the patient. The size of the blade and the corresponding endotracheal tube is printed on the blade, on the individual package, and on the box. These are color-coded for convenience. Blue, size 3 or regular, for use with endotracheal tubes size 7 to 8.5. Green, size 2 or small, for use with endotracheal tubes size 6 to 7.5. Purple, size 1 or pediatric, for use with endotracheal tube size 4 to 5.5. Gray, size 0 or infant, for use with endotracheal tube size 2.5 to 3.5. Turn on the light and anti-fog system. The switch is located below the battery cover. If no light is seen, replace the Airtraq SP blade. The light stops blinking once the anti-fog system is fully activated in up to 30 seconds. Lubricate the endotracheal tube and place it into the lateral channel, or place the lubricant directly into the channel. Align the end of the endotracheal tube with the end of the lateral channel. Do not extend the tube past the end of the track to not obstruct your view.
And that's a review of the laryngoscope blade. Now we'll review a short video about how to attach the camera and the laryngoscope blade.
To mount the Airtraq A390 Wi-Fi camera onto the blade, start by removing the eye cup. The screen should be in the opposite direction of the blade's tip. Make sure the camera is fully inserted. The camera will automatically turn on and start in live video mode. The boot up time is approximately 4 seconds. You can also manually select the power on pin at the base of the camera to turn it on.
So that's a review of the intubation blade and the A390 video head. To operate the A390, as shown in the video, you can see on the right-hand side where the pin is located underneath of the camera. The camera will turn on automatically when a blade is attached, or can be turned on manually by pressing in on the power pin. To turn the blade off, press the power off icon. You will be asked to confirm and given the option to cancel if you do not wish to turn the device off. The device will turn itself off after 5 minutes without a blade attached, or after 30 minutes if a blade is attached. Pediatric mode is indicated automatically when a pediatric blade or a neonate blade is applied. The icon will begin to blink. When the icon is pressed, the icon will change and a message on the bottom of the screen will indicate that pediatric mode is on. Pediatric mode will change the zoom and light to facilitate a better view. The image rotation feature allows for face-to-face intubation in less than ideal circumstances. This can be activated by pressing the 180 button indicated on the top of the screen. Again, video recording is going to activate as soon as the blade is attached. To manually start recording, press the record icon. To stop, press the stop icon. When stopping recording, a message will be displayed that gives you the option to cancel before recording stops. Next, we're going to review a short video on how to properly insert the endotracheal tube when it's inserted in an Airtraq video laryngoscope system.
Gently grasp the Airtraq SP blade with the tip of the blade facing away from you. Place your thumb in the notch on the back side of the blade, holding your other fingers on the front side of the blade. Suction the airway prior to insertion as required. Insert the Airtraq SP blade into the midline of the patient's mouth. Avoid pushing the tongue inside the oropharynx. Continue insertion until the epiglottis is identified. To use a MAC technique, place the tip of the Airtraq SP blade in the vallecula, pulling the tongue forward. To use a Miller technique, place the tip of the SP blade under the epiglottis, lifting it out of the way. Gently lift up the Airtraq SP blade to expose the vocal cords, aligning the vocal cords in the center of the visual field by gently moving the tip of the blade left or right, up or down as needed. Do not insert too deep. If structures, such as the arytenoids and epiglottis, are not recognized, withdraw the blade slightly. Do not put pressure on the teeth with this device. Gently advance the endotracheal tube. If needed, rotate the endotracheal tube clockwise or counterclockwise inside the channel to manipulate the endotracheal tube around anatomy structures if necessary. Check insertion depth and inflate the endotracheal tube cuff as normal and check for proper positioning.
Cleaning the device could not be simpler. In order to clean the A390, all you have to do is wipe it down with a commercial cleansing wipe frequently available from the hospitals. It is important that you do not submerge the camera to clean it, as this will destroy it. Blades do not get cleaned, they simply get thrown away. After each use, discard the blade in red bag trash. Thank you for your attention. We've reviewed the protocol, we've compared the devices, we've looked at the product, and we've discussed how to clean it. If you have any questions regarding this device, please see an EMS officer.